Chapter 27, HIV, hepatitis, tuberculosis, and sexually transmitted diseases. These diseases are often acquired through behaviors that can be avoided or changed, so that's why I have check marks by these next two statements. So nursing actions focus considerably on disease prevention, and prevention takes the form of vaccine administration, early detection, or teaching clients about abstinence or safer sex. Individuals who live with these chronic infections can transmit them to others, so that is why that work is so important. As far as history of HIV, one of the first ones we're going to talk about, the human immunodeficiency virus infection. It is a relatively new diagnosed disease. It's grown enormously in incidence since the 1980s. It's the 8th leading cause of death for persons ages 18 to 44, and it was number 1 in 1995. That has become much better related to new medications, recognition, prevention, and medications. In 1981 was the first report of AIDS, about the time I was getting out of nursing school, and so a lot of people actually even left the profession once AIDS became prevalent and people knew that it was out there. The lifetime costs of HIV are enormous for the person related to medications, because it's ongoing lifetime, in addition to complications such as cardiac problems that can become very astronomically expensive as well. HIV and AIDS has become also one of the world's greatest public health challenges, with persons who live in areas of the world like sub-Saharan Africa. About 75% of the population have HIV or AIDS, including children. In 1990, the Ryan White Comprehensive AIDS Resource Emergency Care Act passed, and this helps to provide services administered through the Public Health Department for persons with HIV infections. Between 250,000 and 300,000 people are unaware that they actually are HIV infected. Genetically, it varies, so it can be very difficult to treat. Some people may, it may change over time, just like other diseases have. But also, it may be very, become very aggressive in some persons, and in other persons not so much. Some populations remain at higher risk, including men who have sex with men, and especially those who are young or who are from racial and ethnic minority groups. Worldwide, most HIV infections are resulting from heterosexual transmission, and in the United States, from 1999 to 2002, about 64% of heterosexually acquired cases were women. The natural history of HIV, the primary infection is a flu-like symptoms within about 1 month of contracting the virus. So most people may not get tested during this time, because they don't really realize that this is what these symptoms are. And so that is why a lot of people do not get tested, because they don't even realize they ever had that, just thought they had the flu or some other type of viral infection. That's what it feels like: achy body, fever, and sore throat, so forth. Clinical latency, the body shows no symptoms, but the HIV antibodies begin to develop. And the final stage is a symptomatic disease, and this is when the opportunistic diseases develop with cancers and secondary opportunistic illnesses. I know I've had patients show up at the hospital, and it was clear once they had chest x-rays and so forth that they had pneumocystic pneumonia, coronary pneumonia, which is an opportunistic type of pneumonia that is prevalent and almost exclusive to HIV patients or persons who have very low immune systems. So certain types of cancers that persons are identified with, then they are maybe tested pretty soon if they haven't identified being with HIV. And then with the advent of antiretroviral therapy, and then the highly effective antiretroviral therapy, which became more prevalent after 1995, when the number of AIDS cases, we began to get a little more of a handle on persons who had HIV and AIDS. And we know that if they are compliant and they get good treatment and they're consistent with their treatment, that these medications can be very effective and can change a disease from the antiretrovirals. We were just using those to control symptoms. Now, the highly effective ones, we can actually use those, and now HIV and AIDS can be a chronic condition that can last 20 years or more instead of being a deadly disease with a very rapid progression. Transmission can be via blood, semen, vaginal secretions, or breast milk. Also sharing needles, perinatal transmission. You cannot get it by sitting next to somebody coughing or sneezing. It has to be an exchange of body fluids and squeezing exchange of body fluids. Office equipment, sitting next to somebody or eating with someone who has an HIV infection will not give it to you. So a lot of those children, like in sub-Saharan Africa, they were actually born with the disease, and also that happens here in the United States as well. And worldwide, the largest number, something to remember, the largest number of cases are from heterosexual contact. And I think I've already covered this one. Let's see, testing for HIV, HIV counseling. We want to counsel the client to receive, get their test results and to assess them for risk. So we want to find out if they have it, and we want to assess their risk if they do, whether they do or do not have it. We want to discuss risky behaviors and how to avoid and engaging them, and to develop a client risk reduction plan, and to establish follow-up appointment and post-test counseling. Now, a person who has a negative result may not be in the clear yet. If they have had unprotected sex within the last 12 weeks, they could still be infected, so they need to be counseled in regard to that. They may not truly be negative for 6 to 12 weeks. It takes about 6 to 12 weeks before evidence of HIV antibody can appear in the body. So if they most recently, within the last day or two, had become infected with HIV, so they could still be have the disease and be developing the antibodies. Some clinics may allow for HIV testing anonymously with just a record of a number or a name or address. Contact information be removed, because persons also who are involved with risky behaviors related to sexual contact may also be may use drugs, and then they might fear some type of prosecution or some type of legal entanglement because of that. As far as epidemiology and surveillance of the HIV and AIDS, it disproportionately affects minorities. Worldwide, 38 million people live with HIV, and as I said, 75% or 2/3 of sub-Saharan Africa. HIV testing and the antibody test, that's what we test for. And then there is a prescriptive when we say a person has AIDS, and I'm going to cover that on the next slide. But caring for AIDS patients in the community, we want to help them identify resources such as social and financial support services, and to interpret school and work policies. We also want to assist employers by educating managers about how to deal with ill or infected workers, and how to reduce the risk for breaching confidentiality or wrongful action such as termination. Now, HIV testing to find out if a person has HIV. There is a rapid test that can give results within 1 hour to indicate if the antibody is present, but not if the person has AIDS. They would have to have additional labs drawn. It is diagnosed in a person who has a CD4 T lymphocyte count of less than 200 mils with or without documented HIV infection. That is the definition of AIDS. That is diagnostic. The HIV antibody test is the ELISA, and it's most commonly used for screening to determine whether HIV is present or not, but it does not confirm AIDS. And so if the person had positive results from the ELISA, then we would do further testing with a Western blot. And you need to know that there is a false negative can be within 6 weeks to 3 months, can be common. So false negative. So if a person, they might need to get tested multiple times, and it is offered at health departments, MD offices, family planning, and the Veterans Healthcare Centers also offer it free of care. Confidential testing for HIV, a person's name and address may be obtained, and the information is considered very privileged. They're federally protected population, and when testing is anonymous, the client's given an ID number that's attached to all the records of the test results, most commonly done this way, and demographic information is collected for trending and reporting only, but there's nothing on there but that number, and the name and address are not recorded at all. And that is, to encourage people that it's anonymous, and that that they will not be any repercussion for any other type of illegal activity. contact tracing. There's his partner notification, and we notify partners of persons who've been diagnosed with sexually transmitted diseases of their exposure to it, and it encourages the person who gets contacted to get tested as well. And care in the community for persons with HIV and AIDS. Children with AIDS should be immunized and should be able to attend school. And bouts of wellness and illness, and they'll need some assistance with homeschooling in those type situations. And it is a very federally protected status and must be kept very confidential within the school. Factors associated with other types of STDs included HIV and AIDS, but persons younger than ages 25 years, member of a minority group, residing in an urban setting, being impoverished, and using crack cocaine. However, this is no respecter of persons. From time to time, we have increased incidence in very rural areas. One person returns there, lives there, and contracts the disease, and maybe they're in a small community, and if they are having unprotected sex, then several people in the community can also contract a sexually transmitted disease. Bacterial is usually treatable with antibiotic. However, there's always antibiotic-resistant forms of STDs emerging all the time. So just imagine that something might happen like MRSA or VRE, one of those type things that this bacteria might continue to change. But that's the good thing about gonorrhea, syphilis, and chlamydia. If it's not changed to some drug-resistant kind, is it is treatable. Viral cannot be treated, like it's HIV, AIDS, herpes simplex, and the human papillomavirus, which is also genital herpes. Those are not curable. Just some information on gonorrhea and syphilis and chlamydia. These are the ones that you typically see the most of, and also, well, there's also herpes there too. But gonorrhea in men, there's usually a burning sensation when urinating with a white, yellowish, or green discharge from the penis. Sometimes the men may get swollen testicles or epididymitis, which causes men to get to the doctor and get checked. Women may not, may be a little more silent, and it may be before they get chronic with like a pelvic inflammatory disease before they realize that they've ever had gonorrhea. Let's see, syphilis is in stages. Initially, it begins with a type of sore that may appear on the genitals. This is your primary syphilis. It is called a chancre, and it develops at the site where the bacteria enters the body. And usually it looks pretty clean. It's not really pussified. It can be up inside the vagina or in the anus, and people wouldn't even know they had it. Or they might, also could get it, I guess, in their throat too. And the lesions usually heal without treatment within 6 weeks. So people may not get treated for it. They just don't even know what's that, and they may not go to the doctor. And then secondary syphilis is the pathogen spreads through the blood, the skin, the liver, the joints, lymph nodes, muscles, brain, and they get this rash that's on the bottom of their feet and their hands, but it's painless, doesn't really itch. So again, people may kind of avoid that, but these painful lesions are also forming in their throat and their bones and internal organs. And at this point, they're still very highly infectious. So this is like up to 3 months after a person contracted. So unprotected sex with multiple partners, you can see how this could spread. And let's see, they may have fever, sore throat, fatigue, headache, neck ache, joint pain, something like that. But significant number of people don't even get that during secondary syphilis. Then the latent is like within 1 year of infection, and it is non-infectious. It kind of goes latent or dormant, and they may convert to tertiary, or they may just stay in that latent phase. But even up to like from 3 years, 30 years, this person, they're no longer contagious, but the bacteria reactivates and spreads through the body, damaging the heart and the brain, nervous system, bones, and joints. And they can get tumors. And so it can be very dementia, ataxia, paralysis. So it can be very, dangerous and irreversible, even years, afterwards. And let's see the next one. So we have syphilis, chlamydia. A lot of times this is, people may not know that they have this. Men can sometimes have some similar symptoms that they might have with gonorrhea. Women may not have a whole lot of symptoms at all. And then develop into pelvic inflammatory disease, and have some problems with with reproduction. Again, just like syphilis, just like gonorrhea, chlamydia um, is it does respond to antibiotics. Herpes simplex, virus 2, there's virus 1, which is usually around the lips, the face, and then there's virus 2, which is genital herpes. And this is a virus that the person keeps forever. And generally, the first outbreak is the worst, with a lot of blisters and then what they call shedding. It's very contagious. It's very contagious. It can be contagious really all the time. Some people can take like an antiretroviral type medication, and it keeps it down. Or keeps it from people from having flare ups. So there's certain medications that people can take, but yeah, protected sex is really recommended at all times, because it can be contracted at any time, even when there's not any shedding going on. Let's say human papillovirus or genital warts, and there is now a vaccine for that, which is Gardasil, and for young ladies, and also I believe they're recommended for young men too. Okay, hepatitis A virus. It's most often transmitted through the fecal-oral route. Sources may also be water, food, or sexual contact. And I think I'd put sexual contact more with hepatitis B. If I asked you a test question, it would be that hepatitis B is okay. So you might get it through sexual contact, but hepatitis B is preventable because there is a vaccine for it. So it would not be, you could prevent it from being spread through sexual contact. Okay. So often silent in children until they really have a lot of GI distress, and some treated with immune globulin, and a young person can receive Hep A. And also, if you have some type of chronic hepatitis B or hepatitis C, you also should be vaccinated for hepatitis A. Hep B spreads through the blood and body fluids. It can survive at room temperature for at least 1 week. There is a vaccine available, so this is preventable. Once infected, you become a lifelong carrier, and it can cause chronic hepatitis or liver cancer. And then Hep C is spread through blood and or body fluids. Most common chronic bloodborne infection in the United States, leading cause of chronic liver disease, end-stage liver disease, and hepatocellular liver cancer, and also for liver transplants in the United States. So this is a disease that a lot of people contracted probably 30 years ago, and now it's becoming, chronic. It's been chronic, just kind of silent, but chronic. So a lot of people don't know it until they've got a lot of damage done, actually, from this. So some people will relate it to people who have been IV drug users, but also there's people who have absolutely no history whatsoever, and who have contracted, hepatitis C. But they encourage people who have it within the household to make sure that they're not using the same shaving equipment, and that they're careful about any type of body fluids, even up to having protected sex, even in a committed relationship. Okay, tuberculosis, TB screening, skin testing with PPD, the purified protein derivative. It is followed by chest radiography for persons with a positive skin reaction and pulmonary symptoms. The emergence of multi-drug resistant TB has prompted the use of directed observed therapy for persons in the United States and other countries to ensure adherence with drug treatment regimens. So if you're getting treatment from the health department, that's going to include a visit from the public health nurse to make sure that that is all going okay. And the only time that becomes a problem is among a population of homeless persons or persons who are transient. And this is an important concept. You might want to write this down. Persons going into congregate living situations, such as prisons, nursing homes, assisted living, group homes, they're going to require TB screening for prevention, for the rest of the population that they're going into, and also for treatment. And symptoms are cough, fever, hemoptysis, chest pain, fatigue, and weight loss. And it is contracted through airborne droplets from persons with pulmonary TB. Um, Most often, tuberculosis is latent tuberculosis. It's very common in older adults who may have been exposed to it at some point, and then when their immune system becomes suppressed, or they're undernourished, or they have diabetes, then they the latent tuberculosis can appear. And also active tuberculosis is about 5% of cases where a person actually has active tuberculosis and they contract it, and they have full-blown TB. The nurse's role in providing preventive care for communicable diseases at all levels of prevention. The nurse functions in the following roles. He or she is a counselor, an educator, an advocate, a case manager, or a family care provider. And that is the end of this lecture.